cold up in here. Greetings, my fellow YouTube nurses. It's late. I gotta make a quick video, and I want to discuss and give you an update on what's going on. But before I go any further, I want to say thank you everybody for subscribing and getting all you guys from my old channel to my new channel. And let's go with the very first question from ProblemChild945. Funny name, cool cat. Says, my name is Mark from Boston. I work in radio and currently looking to change careers. I like a lot of the videos, would love some quick thought suggestions if you have a second. And he basically talks about that he understands the benefits and pros of becoming a nurse. And it simply keeps coming back to those negative male nursing stereotypes, which logically makes no sense. He says, I know it's ridiculous, but it's constantly top of my mind. I was wondering what your thoughts were. Okay, well, becoming a male nurse is greater responsibility than you will ever have in any other I guess job perspective that you have, because you're not just dealing with patients, you're not just dealing with doctor's orders, you're not just dealing with labs, diagnostics, you're also dealing with the family care, you're also dealing with assessments, like I said earlier, and medication, IV routes, I mean, the whole holistic picture. And that's just one patient. So imagine you have 4 or 6 patients. Of course your care, your anxiety level, it's going to go through the roof. But you got to learn how to like deal with it. And I guess being a male it's kind of awesome, because you're also going to be looked at kind of like, oh cool, we got a strong person up in here that can help out with these females. And being smart in that perspective is a plus. So that's my thoughts on that. Let's go with the next question. He says, did you deal with any at that point, and how did you get over it? Yeah, I did. Actually, I did deal with it. In nursing school, it was only like 3 or 4 of us guys out of 25 to 30, no, about 30 students. So we were like the low percentage of the class, but we dealt with it, we did it, and a lot of my friends were kind of like ridiculing me a little bit, just saying, oh yeah, you want to be a nurse? Why don't you become a doctor? Or why come you want to be a nurse? I mean, everyone looked at me with like that little twitch in their eye, kind of like, what? They didn't believe me. And then I had some family members who were like, why don't you do something else? But I just knew in my heart that's what I wanted to do. So yeah, I was a little ridiculed by it, but I've always thought that's something that I've always wanted to do. And I achieved it. So you just got to follow your heart and just do what your heart tells you. It also says, did you all feel like you were settling? I'm trying to read what he's saying. He says settling, aka not becoming a doctor. Settling, no, I did not want to settle. I'm there with the patients, hands-on, assessments, you know, I do my implementation, my evaluation, and I'm there talking with them one-on-one, not through, you know, 3-4 minute round that I see the patient, I'm out. I'm there hands-on and talking with the patient and family members. So yeah, I definitely want to become a nurse, not a doctor. I mean, you got to be there with the patient. The other one that he says is, did you come across some of that negativity nowadays, and how did you respond? Are you serious? Of course I did, man. There was one lady, Caucasian female, straight says, get out of my room. And she pointed at me like I was evil, like I just did something wrong to her, and I never even met her. I'm just doing my rounds, ready to walk up into the patient's room. She goes, get out of here. I don't want a male in here. So I didn't take it personal. I just said, okay, look, ma'am, I'm your nurse today. I'm taking care of you. If you don't want me, it's okay. We can get another, you know, female, whatever. And she just said, I want a female. It's disrespectful having a male come in here. So I said, okay. I didn't take it personal, but she was those old school individuals that they followed the book. You know, they want what they were back in the day. All nurses that were females, and the guy had to be a male doctor. Well, it's okay. That was a stereotypical response she gave me, so I just gave her on, passed her on to another, you know, nurse. But, you know, you got to look past that. The skin color, the nationality, the culture, it's about what you know up here, you know. So if you're able to do assessments, evaluations, and know how to, you know, do the whole proper medications and take care of the patient in a holistic way, why are they going to look at you and look at your skin color, right? So I looked at it like it wasn't a big deal, and I kind of responded just in a regular professional way, and you just got to deal with it. It happens, but 90% of the time it's not going to happen. I mean, maybe a small 10% chance, but it happens to everybody. So that's the way I responded, brother. His name is ProblemChild945. Hopefully that answers the question. And yeah, and I want to say, guys, I left my other job, put my 2 weeks, and now I got a new brand spanking beautiful new job. It's medical, surgical floor I'll be working in. So I'm going to keep you guys updated with brand new videos. All your guys' questions, I'm going to respond to them whenever I can. So I got a lot of things going on right now. A lot of changes I had to squeeze in this video because I'm going to be moving pretty soon. So my fellow YouTube nurses, keep subscribing, keep commenting, and keep liking. So I will talk to you guys later. Alright guys. Good night.